She don't have strong. She's very weak. Even walking, she can't.
So I went there in 2007, Father Sam and I, and we, got to see patients, and over 400 patients during that 2-week trip. And the thing that impressed me the most was the fact that I saw pregnant women that were laying on the floor in labor at certain health centers, and it was very upsetting to me to see the women in pain and in labor delivering their babies, most of the women had malaria, and they were delivering their babies on the floor and in pain, and so it was very upsetting to me. And so I told Father Sam during that trip that we should start something and organize something to get some money to bring to Northern Uganda to improve the healthcare system.
Over the years, since 2008, we have made a lot of gains in this place. We started with the emergency unit, and it has transformed lives. For many years now, we see patients come and immediately they are seen within 5 minutes. Trauma patients, those with hypertensive emergencies, remarkable. So we are very grateful to our donors, to our supporters who continue to support us. And this also has attracted more patients, and more complicated the patients come. And that also calls again for continuous support, because now we are a referral center, a referral hospital. We see patients from surrounding districts.
Routine approach that they have in the U.S. inside the last 2 weeks.
The 3 typical most common causes of maternal death, which is infection, high blood pressure.
It's a racemic mixture, and the active component is escitalopram. We don't use a lot of citalopram anymore because the racemic.
General, we are in Bara. Tendo kuburi nyani. Nagatina pinkan, mutiana rema.
So yeah, Dr. Sam said just check his sugar, and then he will see him for his. Just tell him I don't take care of him. He will go in to see the doctor.
No alcohol.
Thank you very much, our dear guests. We welcome you to our health unit. We are very grateful and we feel we are blessed.
We came for patients and we wanted cases of hypertension, diabetes and heart diseases.
Then they decided to donate for us some little money, which they put up a very nice, beautiful theater.
It makes me so happy to be able to help translate from English to the Lango language for them to be able to understand and take the prescriptions, right?
The only challenge is we don't have some of these patients captured in the system. Just at Aloy, they did very well. We have a couple of patients that have been registered. We are following them very well, and from the report we got there, they told us they are all doing very well. Their blood pressures are controlled, sugars are controlled, and none of them is really getting this complication.
When I came here 11 years ago or 12 years ago for the first time, and now I look at what has changed, buildings that weren't here, the grounds are cleaner, there's additional lab equipment. It's the differences are amazing, and we can continue to see them year after year.
It's been such a change from my first year until this year. The improvements made with help from our very generous supporters have been just astronomical.
All the vaccines are free here. You don't pay for those at all. All the children are vaccinated. It's just amazing to see the differences that we do.
I don't mind contributing both time and money to this because I know that it isn't wasted. We talk about efficiency and how much of the money is used to actually improve patient care versus how much is used for staff salaries or executive salaries or advertising.
We see up to 100 patients in a day almost, and many mothers sleep at the veranda on the floor. Every night we walk past, we see mothers at the veranda with a mosquito net covering themselves. So that's our next project.
I've looked at other charities online, and there are some that are remarkably good. But what's particularly good about this one is that there's no salary for the chief executives. There's very little expenditure on the advertising. All the money that I give to MANU goes directly into provision of equipment and care.
So we feel very confident and very proud that we've come this far over the last 13 years or so, and we feel that donors that are coming back year after year are coming back because they know that we're doing these projects without the money going to other useless administration fees.
When you go back to America, even if you have not gone back to America yet, please send a message to your friends who can help us so that they can come and build for us at least a medical center so that we can get treatment in a nearby place in our area of catchment area. Thank you very much for listening to me.
Great.
Thank you.